So on this summit, we are focusing on pain. And I have personally treated many patients who have recovered with cancer, and it can be a very painful experience. And there's lots of different types of cancer, but just talk to us, kind of give us a good overview of how cancer causes pain for people.
Well, cancer patients are pretty uncomfortable a lot of the time. Sometimes pain itself will be the symptom that takes you to the doctor because there's what we call tumor-generated pain. So that may be that you have a mass that's pressing on nerves or blood vessels or an organ and you notice some pressure. And let me just say for listeners, even if you have a dull pain, check it out because that could be as loud as the symptom ever is. There can be also pain after surgeries and procedures like biopsies, invasive procedures. There can be pain if you have a port because you're receiving chemo, and that might be in your chest or in your arm. You may have developed a blood clot. You may have a lot of inflammation from the therapies you're receiving. And so there's a lot of reasons that people have discomfort when they are cancer patients, and a lot of the side effects of the treatments can be long-term. So you might still have inflammation or pain, or you might have scar tissue, what we call adhesions, scar tissue that forms inside your body after a surgery or after a lot of inflammation. It's kind of gristly and it presses hard on things. So there's a lot of physical reasons and inflammatory reasons primarily why people have pain.
So it's really interesting because you're talking about inflammation. And obviously, we know that inflammation is directly linked to pain. It's one of the 4 cardinal signs of inflammation.
Yes.
But talk to us about how inflammation can start the cancer process and ignite, let's say, tumor cells.
Well, the word ignite is a very good one, Joe, because if you think of inflammation in your body sort of like lighting a match, right? It's like a little hot spot, a little fire, and that might remain like a ember or a coal and just be low-level chronic pain, or it might be a big flare of a fire and be pretty hot and pretty swollen. But either way, the presence of inflammation itself is a setup for damaging DNA. But tumor cells themselves produce a lot of inflammatory molecules. So you have inflammation coming from both directions in cancer. So that also is why you feel so tired when you have pain that's from inflammation or fatigue that's cancer related, because the inflammation itself can be exhausting. So on top of being in pain, you also may be extremely fatigued.
Yeah, there's definitely that kind of play back and forth between kind of that fatigue as well as that pain. Now, I know in your practice, you and I have talked before that you use a lot of kind of natural methods for alleviating pain in your cancer patients. A lot of them are already on a lot of types of medications, or they have chemotherapy, so you're kind of going the natural route to, it's a way where things interact less. Tell us about some of the natural alternatives that are available for pain reduction in cancer patients.
Well, there's a couple of things that I'd like to highlight. Number one, acupuncture is a great tool. And so if you're under the care of a physician that's worried about drug interactions, you don't really have to worry about that with acupuncture. So acupuncture is used anywhere from once a week to 3 times a week if you have bad pain. And if you have chronic pain, you might want to consider a series of 10 or 12 treatments to really change the pattern. So acupuncture is a great drug-free tool that usually most physicians don't object to that. There also is a wonderful Chinese herb that I think is one of the best botanicals for managing really bad pain, and that is Corydalis, Corydalis. It's a Chinese herb that's been widely studied, and it is excellent for pain that is derived from nerve pain as well as inflammatory pain. And it also can help you sleep. It is not habituating, so you won't get hooked on it. And it's a little bit sedating, but even if you take it during the day, you won't feel too sleepy. So I have patients with all kinds of pain, but particularly cancer pain can be quite bad. So this is a really good herb to know about. The other 2 herbs that I use the most are curcumin, which is a plant chemical that comes from the root turmeric, the bright orange yellow curry root, and also boswellia, Boswellia. And you can actually get the resin, the boswellia resin. It's actually frankincense. Mm-hmm. Or you can get the concentrate called boswellic acid, and that is far more potent. And both of these plant chemicals actually enter over 50 different pathways that have to do with immunity, inflammation, tumor growth, and pain, and control of pain. So these are very simple, very, very safe. Mm-hmm. And the one thing that you have to know, many people are familiar with some of these more common herbs. There's a big difference between a nutritional dose of something and a therapeutic dose of something. So if you're going to get an effect, you have to actually take a lot. And with herbal medicine, it's plant material. You can't shrink it into one little tiny pill. So quite often you might be taking 3 or 4 capsules 3 or 4 times a day to achieve a therapeutic dose. But you think of it like food. You know, you wouldn't think that would be too much food to eat. So that's why people think that herbs don't work, is they really just don't take enough.
Yeah, so the take-home message there, I mean, a lot of people have heard of turmeric before, and they may sprinkle it on, you know, their chicken or their rice. But for that therapeutic dose, you need much higher quantities. And I think most people don't, it's not talked about often, I don't think.
No, so let's get a little more specific. You'd want to start at a baseline dose of curcumin around 2,000 milligrams. Some of my patients take 6,000. Mm-hmm. But you would want to do that under the supervision of a professional, because the one caution is that both of these plant chemicals can increase your tendency to bleed. So if you are on blood thinners, or you have low platelets, if you're a cancer patient, then you want to consult a professional before you take high doses of these.
Excellent, excellent. So we're here with Dr. Nalini Chilkov. We're talking about how to recover from the pain of cancer. So earlier you mentioned detoxification and how the toxins in our environment can be so problematic. Can you give our listeners just maybe 1 or 2 tips about how to just, you know, be mindful of detoxing their life, whether they have cancer or not? Because obviously, when we're talking about prevention, it's really important to detox so that you don't obtain cancer. So the cancer doesn't land on you and your family.
Yes. And of course, a lot of cancer therapies themselves are toxic, you know. Right. So one of the most important things is just take a walk around your house and look through every room in your house and see what kind of chemicals might be there. So you might find that if you're in your bathroom and you're looking at your personal care products, then you want to be sure there's no parabens, Parabens, in your self-care products. So cosmetics, body care products are just full of chemicals that are absorbed right through the skin. So a really good practice is to make sure everything you use on your body is safe for you. And so you can go to a natural food store, for example, where you'll find brands that are committed to non-toxic products and ingredients. If you walk into your laundry room or into your garage or into your kitchen, you want to look at the soaps and the cleaning supplies that you're using and make sure that they're not toxic. And, you know, if you have children in the home, it's really, really important, because if you think a smaller body exposed to the same amount of chemicals is going to get a bigger dose, you know.
That's interesting.
And so with children, it's just very important to keep your environment very clean, because by the time someone is diagnosed with cancer, that tumor may have been brewing for 10 to 20 years. So it may be that we were quite young when our DNA got damaged. And so if it could be repaired, then we won't develop cancer. Or if the environment around that little group of cells will never permit it to grow and spread and travel, then you'll never be diagnosed with cancer. But quite often this happens early in life. So it's really important to also protect children, but educate them as well.
I hope you'll join me for my comprehensive Foundations of Integrative Oncology course, which includes monthly live grand round calls with me where you can ask your questions. You can start transforming your practice today so that you can become the go-to expert who is truly prepared for the rising tide of cancer patients and survivors who who are looking for a skilled and knowledgeable clinician who can provide them with the health side of the cancer equation and help them take control of their health and support them through all phases of the cancer journey and beyond. Click on the link below now to get immediate access to all of the modules, print-on-demand patient support documents, and quick reference clinician guides, as well as learn how this course has transformed the way other clinicians like you practice.